or from addiction, for how long are they usually in that situation? Is that something that you might know? Like, how many years are they living in Lawrence with, you know, for example, if I were to meet a panhandler, you know, in the corner, what would you say is the average amount of time that they've been in Lawrence?
It's difficult to tell. And if you were to do this point in time count in the summer, you probably will get a different count and a different group of people, right? We have to be careful, because mental health conditions, 1 in 3 people suffers from a mental health condition, whether undiagnosed or not. So that could be you and me right now. Now that gets further compounded by socioeconomic factors. If someone loses their job, if someone is it's living in, you know, in substandard housing, if someone has a family, if someone is a victim of abuse. I mean, all those things compound the issue of homelessness, right? If you don't have a house, I think that's the most basic need of any human being. If you don't have a stable home, you really can't do much. You cannot go to school. It's difficult for you to get a job. I mean, all these things play a role. You look at transportation, you look at cost of living, all those things impact. So that's one thing. And then substance use, we have a major issue with opioids, and it's not just those you see on the street. Just so it happens that the choices that probably those human beings were facing brought them to be on the street. And then you have your chronic substance users, you know, that it's difficult. It is an addiction. It is a medical, I mean, they have, they call it an illness for a reason. We're talking about alcohol abuse, which is sometimes often, I want to say, probably equal or worse. And so you may have people living the same, facing the same situations in their lives, but may not necessarily be homeless. So this, we tend to associate, and this is part of the stigma that we always talk about. You always associate those chronically homeless with all these things, when in fact, you don't know if they're using because they're trying to cope with the situation, or it's the other way around. And so I think that that's the piece that we need to understand, that these people have a condition, they have a situation, and now they're homeless. And so, and then you have all kinds, right? Because you know, I understand that the availability of drugs in certain places, and not just Lawrence. I mean, this is a corridor that comes all the way from South America and all the way up to Vermont and Maine. And so that also plays a part in this. So it's hard to tell. I don't think there's, like, for instance, with domestic violence, I can tell you that it takes about 7 attempts for a person to actually free themselves, those that do. For substance use, it's a little different. It depends on you know, on how severe it is, what's the drug that they're using, what kind of support system exists, and what's their situation at that point in time.
Okay. You know, I think every time we touch on this subject, one of the things that people always ask themselves is, you know, are these people from my community? Like, where are they coming from? And, you know, I think, you know, if I were to, and this is just anecdotal, right? So this is definitely not my expertise. This is one of the reasons why I'm bringing you on here, because I think it's important for people to hear it straight from someone that works on this. You know, my view is that I feel like a lot of the individuals that I see in the corner, and sometimes that's what you, because this is what you're seeing, you believe that everybody's sort of in that same situation. You know, they might look like they're from, you know, they might be coming from Lowell, who knows where they're coming from. But the way that I view it is that once they set foot in Lawrence and they're saying that they're going to reside in Lawrence, then to me, that's a Lawrence resident. I think one of the things that I find beautiful about our city is that it doesn't matter where you come from. You can come from, you know, Dominican Republic, Nigeria, whatever. Once you're here and you say you're a Laurentian, like you're a Laurentian, nobody questions that. So you know, that's something that I value a lot, and I know that you know, the city doesn't differentiate or ask, like, you know, how long have you been here for? You know, there's no like passport of how long you've been in Lawrence. It's like if they find a need, they start working on that. But on that, you know, one of the things that I think it's important to, before we get on to sort of like what we came here to talk about, is what was the frameworks that existed in the city of Lawrence? Because I know that they were exacerbated by COVID-19. So if you can talk, you know, briefly about the different frameworks that, the framework that existed, but also in particular talk about some of the shelters that were on that, unfortunately had to close down, like Lazarus House. So so I think that would be a really good sort of segue into the main topic.
Sure. I think the framework that existed is you had a lot of nonprofits servicing the community, right? Servicing the population, both the homeless and housing insecure. In recent years, I think that, at least for me, one of the things that I noticed is when I was coordinating the Mayor's Health Task Force, which I coordinated for about 7-8 years, I noticed in a lot of the working groups that we were trying to organize and target some of the health issues, health concerns within the city, it didn't matter where we were having conversations, the issue around homelessness was brought up. For instance, if it had to do with chronic health conditions, people who had no stable housing or no stable address is very difficult to provide treatment for. Then you looked at people who needed to do follow-up for breast cancer or for prostate cancer, and you couldn't really get anybody provide the services that they needed because they didn't have a place to live. That was very difficult. Then we had a behavioral health working group that was trying to provide services for that population. But once a person is released from the hospital and has no place to live and no address, it's very difficult to do any follow-up. So it came from almost like a health equity, health disparity, I want to say, perspective, at least for me. I know that homelessness has been an issue for a long time. It's just that we see it more because we have increased numbers. We have issues around housing, the cost of housing right now, and many other things. I mean, we have a very densely populated city. Our vacancy rates are very low still, even though we have a lot of new units coming online. Housing affordability is an issue for families. And so I started to have this conversation, and I had an idea. I think that the Mayor Rivera had called, and I think it was precipitated because of the homeless under the Casey Bridge. And so the mayor had a few meetings, open meetings with different sectors. And one of the things that I noticed at that point is that there was some resources, but there was a disconnect. There was no coordination of services happening. And so at that point, I said, you know what, how about we find somebody that can serve almost like the coordinator of the Mayor's Health Task Force, but for the homeless, so that she can understand, or he can understand what are the services that exist and start coordinating and connecting the dots and actually addressing policy and system changes so that we can start moving the needle. And I think that has happened, and there has been several platforms. Most recently, there's one around youth, homeless youth, and it has been very active. They've done summits, they've done surveys. I mean, there has been a lot of movement around it. But once you create a position within the city, then the pressure begins, right? Because now they're looking at this individual, like this individual is going to fix every single homeless problem in the city. So I think that was it. I think that moving forward, we've seen a lot of the partnership and that collaboration, that coordination come together. We saw it when for the gas explosion, but we're seeing it more now significantly as we all come together to create a response for this issue. So
that's great. And I think so one of the things that I remember hearing about, it was that there was a call made because Lazarus for a long time was running a shelter here in Lawrence. I think one of the ways that I started learning about homelessness was through Lazarus House and through the amazing work, incredible work that they were doing. And they taught me, I always knew the importance of a home, but seeing how that stress of knowing where you were going to live, relieving families of that stress, how important it was for them to start learning other skills to help them, improve in life. Seeing Lazarus House sort of work through that kind of helped grow and help me understand more the importance of, working the homelessness issue. Is Lazarus still running their shelter? They are? Yes.
Well, right now they're closed. One of the things that we've seen as a result of this COVID pandemic is that many of the employees, many of the shelters are losing staff, either because they don't want to be exposed to the COVID or because they have become ill. I mean, there's a series of things, but Lazarus House is still open. Actually, I mean, they're closed temporarily, and we actually are housing their families at one of our hotels. This is one of the partnerships that we have. The same with some of the Daybreak folks. And so they're still there. And actually we're in partnership with them for our isolation and recovery site that we're working on. So there is a small, but there is a shelter system that existed. and still exist. So Lazarus House has a couple of transitional housing programs. Then you have Daybreak, that it's more for individuals who are struggling with substance use. Then you have your domestic violence emergency shelter, and then you have Casa Nueva Vida, and then you have other providers within the city. So what I've noticed is that there's more conversations, and then on top of that, then the Family Health Center has strengthened their homeless services that they use with the mobile, with a mobile unit that goes out. I mean, you're seeing an increase in services, but the level of resources probably do not, supply and demand don't. The demand for the services and the support and the resources do not go along hand in hand with the supplies.
Yeah, and that makes sense. I think every time that you look at pretty much all the services that different nonprofits provide, it's very rare to find a nonprofit that's like, we're meeting all the needs, right? Like we don't need any resources. And I think in this case, we see it a whole lot more. One, I think we're in a city where we have high population growth. I think it's a huge. We've seen a lot more people out there in the streets, but also this housing insecure population is a population that's hidden, we don't know about. There's so many people that are right now staying with a friend. And it's a situation they're not going to go out anywhere and report themselves because they're pretty embarrassed about it. But I think it's important to understand that as a segue to to a conversation regarding COVID, because understanding what was there before, seeing how it was exacerbated by COVID-19. I mean, imagine running all these different shelters that are being run. More people need to come in because perhaps it's harder to ask a friend to stay with them if that friend is afraid that this individual might get their grandmother sick, who knows, right? So you're having that. And then also workers might be not able to, go to work, whether it's because they got sick themselves or they don't want to put any of their family members at risk. So it definitely puts it creates a sense of urgency on the problem, and it also exacerbates the problem because the previous organizations, individuals that were working on this no longer can. But as we move forward in that, one of the things that I think would be important to talk about is sort of why are homeless individuals at risk? Like I can sort of imagine, why they are, but I'd love to hear from you as far as, the data that you've been presented as to why this is an at-risk population. Because a lot of times I see that they're young, right? So usually, what we were told is that you have to be 65 and up, and then you were at risk. But I think that that definition is very general, and homeless individuals are sort of that exception.
So one of the things that CDC and Department of Public Health, Center for Disease Control, and the Mass Department of Public Health have issued some protocols, right? So safe distancing. So you have some people that are living in double up, triple up housing, and you have someone who's in a shelter living in congregate setting that it's very difficult for you to do that, right? People who are homeless, particularly the chronically homeless, I mentioned before some of the conditions, if they have any chronic conditions, any chronic health conditions, and they're not taking care of themselves, they're more likely to get infected. You're supposed to be washing your hands every 20 seconds with lots of soap and staying at home. If you don't have access, particularly for the chronically homeless, if you don't have access to water and soap, it's very difficult. And then staying at home, for some of them, means staying at home in a shelter where there's overcrowded, probably, or in a rooming house where there's other people living there and you're sharing bathroom and you're sharing some of the facilities with other people. And what happens with this? Then you expose yourself. We're seeing this happen with some of the shelters in the city. We've seen that happen with one of the rooming houses in the city. Some of the shelters had to move, for example, I think it's Casa Nueva Vida have like 5 sites. They ended up moving everybody to 4 sites and leaving 1 site so that they can have someone isolate there. And so it's very difficult if you have poor health to begin with, then you're not, your immune system is already vulnerable. So you are more likely to acquire this virus. congregate setting. I talked about it, aging population, talking about 55 and older. And usually when you're 55 and older, you tend to have certain chronic diseases. And on top of that, if you're homeless, then it just puts you in a higher risk for the virus. Limited ability to follow public health advice. I just mentioned that. Even communicating with some of the homeless. Some people don't get the information as much as we're putting information out through social media, through, lift links, flyers. I don't think that population, that's the way to get the information to. And I'm talking about the chronically homeless. Now, someone who's already worrying about where am I going to sleep tonight, and am I going to be kicked out today? It's not thinking about washing their hands every 20 seconds, every 20 minutes. So, and then there's this stigma and discrimination that we've seen. We already see it because people see there's everybody that's homeless automatically you're attaching all of this stigma. Someone who has, I don't want that person in my space. That person, it's using drugs. That person doesn't smell well. That person, there's all this discrimination that goes with it. And I don't know if you noticed, but typically that is the last sort of population that we think about, right? I'm really happy that in Lawrence, we have such a strong partnerships because back in I want to say March, right away, we had a call with the clinic, Early Lawrence Family Health Center, the doctor Dr. Ryan Dono. We had a conversation with Lawrence General Hospital, which are our partners for the Mayor's Health Task Force, with Martha Velez, the Health and Human Services. There was a large group, the police department, and we started having this conversation, like what is going to happen? Because you have the unsheltered who are chronically homeless, and then you have all these people you're supposed to depopulate some of these shelters and depopulate some of the spaces. How are we going to do that? What are we going to find? Where are we going to put people? And that conversation started early on before, a lot of this health advisories and guidance came out. We started having the conversations early on. A local response system, understanding these things, and we are working with our population. Understanding this, we knew that we needed to find a place or places where people could either quarantine, people who have been exposed to the virus but are not COVID positive, or people who have no space where they can safely distance themselves, or people need to isolate and recover, those people who get the COVID-19. This was even before the shelters were set up across the state, and we started thinking about this because we knew we had a large number. And I say 230 point in time count, but I'm pretty sure that the clinic is going to tell me, yes, it's probably more. It's more like in the 300s. I'm happy.
I'm sorry to interrupt, Vilma. So just walking us through the timeline, I think, one of the things that people look at when we're dealing with issues of emergencies, whether they're national, local, whatever they are, is that they look at sort of like response time. And I think that, with certain things, it's easy. Like if there's a fire, it's easier to judge. We have a fire department that does exactly that, stop fires, right? But when we're dealing with human crises and dealing with issues that are longer lasting than sort of like one-term fixes, there's sometimes the timeline in responding to them is not day of. And people sort of question that. So if before we get there, I know that there's tons of questions as to when did we start? And you just said that we started thinking about that the city started thinking about that from day of. Sort of how long did it take the city from putting these thoughts on paper to actually enacting something, and why these ideas couldn't just be enacted from one day to the other?
So we started talking about this in late March. We had some conversation. We started exploring what are best practices, what is happening somewhere else. We looked at models in California, because California was getting hit really hard. And we looked at a model in Boston. And then we had to learn about all the pieces. You got to remember, this is an unprecedented event. This is a pandemic. This is a global pandemic. And so nobody's ever ready for something like this. Just a month or 2 months ago, probably before that, we were talking about emergency response and meeting with other cities' health departments and with our chief of fire, Chief Moriarty, talking about what happens if we get a flu, what happens if we get a pandemic. Little did we know that it was coming, and we had to deal with all this. So you have to work with your emergency management director, which is the chief, and you have to work with inspectional services. So we started thinking about, okay, how we don't have a place in Lawrence where to set something like this up, and how are we going to put everybody together? So you have to start thinking and talking to the Department of Public Health, to your local board of health, to all the people that have a say, because I am not a medical, that's not my background. And so how do we do this? No funding, because there was no funding yet allocated to this. How do we get MEMA or FEMA to support this? Guidance took a while for guidance to come out for MEMA. Took a while. I mean, we're just still getting some guidance from HUD, and we just got the funding, which we haven't been able to spend because I have to go before City Council. And we have to request waivers and have them suspend some of the regulation because the funding got added to our existing fiscal year. Our annual action plan. So all of this bureaucracy gets in the way, and then you have to build partnerships, and then you have to staff it because it's 24/7. Then you have to figure out what's the best place. Then they started talking about hotels and motels as the goal. Then we started making phone calls to local hotels. Nobody wants anybody with COVID in their place. So we have to start with, okay, if we can't waste any more time while we work on that, how about we start thinking about how we're going to depopulate some of the places that we have, so at least we can provide a safe space. And it wasn't until we worked with a couple of hotels, and finally the one in Andover, DoubleTree, was really welcoming and worked with us. And that contracts take a while. You have to go through the legal, realm of things. All of those things need to be in place. We have to figure out how to get laundry and get the laundry for this guest. We have to figure out food, transportation, put together protocols really quickly. I mean, you have to take temperatures twice a day. You have to log it. You have to do reports to the Andover Public Health Department because they're in Andover. I mean, people don't get the gist. And then I have to hire people. And then we have to figure out how we're going to pay for this since we don't have any funding yet. And so people sometimes think, have opinions over, well, it took the city a long time. Well, we are a city, and this kind of government institution is not used to probably working at this level. So I want to say it didn't take long because we started in late March, and by I want to say mid-April maybe, we already had a hotel, and we were accepting referrals, and it was Lawrence General and Greater Lawrence Family Health Center particularly who were putting pressure because they were releasing people, or they were telling people, you need to quarantine, and people had no place to go. And so we started to work with them and open up the first one, which I don't know, whenever you're ready, we can talk about it. But I think that
I want to make sure that I read a statement that the mayor sent me early on. During this unprecedented national state of emergency, the regionalist homeless problem has been made worse by the COVID-19 virus. State public health and local hospital medical staff forced the region to move quickly to deal with the matter to stop the spread of the virus. After much last-minute work, there is a regional support effort in place that we expect will be disassembled once we are through the crisis. We all appreciate that every community in Greater Lawrence is doing their part. And I think, this statement sort of, speaks in general to some of the things that you were talking about. And I think, one of the things that I want to highlight is that we're not yet done through the crisis. I think, you mentioned sort of how difficult it is to get any program off the ground.
In a short time.
Right. Well, I mean, forget a short time, right? Like just getting any program.
General.
Yeah, and getting people to agree to things, especially when we're dealing with money, but now we're dealing with like health issues. Like there's just so many different things that you have to juggle, you have to connect. There's so many things that are at risk. So to do it right, I think it's something that does take time. I definitely, if you would have asked me, I would have loved it if like March 22nd, there was an order. If March 23rd, Lawrence already had something, up and running. but we did it. Who could have prepared for that? But one of the things that I agreed, I remember, I'm paraphrasing, but I know that the mayor, there was a statement the mayor made, essentially, talking about sort of the resources that Lawrence currently has. I think that we are a city that, our population, it's low income. We're a working class city. We don't necessarily have the resources of Cambridge and some of these other municipalities to deal with this issue. And I think one of the things that I 100% agreed with is that in order for us to tackle this issue, we needed state support. In fact, if it was up to me, I would have thought the state would have been the one that would be leading the charge, not necessarily Lawrence. Like, I'm glad that Lawrence is doing just that. But I definitely think that, seeing sort of, how high that there's so much need in the city, especially dealing with COVID. I would have hoped that the state would have been spearheading certain things. But, after some conversations with you, it looks like that's, one of the things that eventually has happened. But I think one of the things that I want to make sure that is addressed to our conversation is for folks to understand that sort of like what you guys were thinking and how you came about with these decisions. And also that while nationally there might be messaging being put out there that we're almost done, folks, we're not almost done. Like, we have no idea when we will. Hopefully, in several weeks, couple of months, we are. But until this response is done, it's great to hear that that we're working on this particular issue. But now to just kind of go more in details, if you can talk to us about the temporary shelters that were created, and go a little bit more in depth about the criteria, where they're at, and also the capacity level.
Sure. I think that just before I start talking about that, what we learned also that was required for immediate local response system is what we did. And people may not understand it, but this is what it was. Basically, they asked us to identify appropriate isolation and quarantine sites. Those are two different sites. So that's what we had to think about. We needed to look at prevention. So prevent loss of housing and healthcare services, because you don't want more people on the street. Expand shelter capacity and deliver services to the unsheltered population. That is something that we have done through expanding this temporary shelter that we're doing, and then working closely with the clinic to be able to support them as much as they can in some of the work that they do with the unsheltered population. Ensure providers have supplies and protective equipment. Protective equipment, it's, as you know, high demand, and it comes through our chief Moriarty. And so we have to wait until that order, that shipments came in, and then expand medical respite care programs. And we're doing that through our isolation site, and we're doing that with telehealth. So we're working closely with the clinic and the hospital so that people who have a doctor and need to see a doctor, they're able to do it through telehealth services, or people who need to have be enrolled in health insurance. So you have to think about those things. But yes, Lawrence thought about these things, and I remember meeting with the mayor and writing it on the board, because it was really interesting to see why we need 3 sites. The number one site that we got off the ground, it's in Andover, and that one is for the homeless and housing insecure individuals. And so what we cannot accept there, and that's per the hotel. That's the hotel said, I'm okay, I'm gonna play nice. They reduced their rates significantly for us, but you cannot have anybody who's COVID positive here. So it can only be people who have been exposed to the virus and needed a place where to quarantine, which is typically 2 weeks, which is not the case. And people who needed to, who were living in, for instance, we have people from a rooming house they needed to depopulate some of that space. We have people, all the families from Lazarus House, but 60%, according to Sandy, our homelessness initiatives coordinator, 60 to 70% of the referrals that are coming from the hospital and the clinic. This one is for Lawrence residents. This is we have 2 shelters that are only for Lawrence residents. And that one is has 24/7 staff. I mean, not 24/7. I'm sorry. That one has staff between 9 o'clock in the morning until 11 o'clock at night, and then has security overnight. Residents there receive laundry services, 3 meals a day. They're taking, all the medical, temperatures, things like that, we have to monitor their health to make sure that they don't develop symptoms, because then otherwise we have to move them out. And that one has a capacity for 80 rooms. But right now, we are stopping. It's that referrals are stopping slowly. So we may cap it at probably 60, and then use some of the funds to support some of the guests that need to stay a little longer because they're waiting for housing resources. Our goal, really, this was created as a public health measure. But if we are able to help assist any of these families or individuals to finding something more secure, more permanent in a way, that we're doing that. So that one is, it's anticipated to close by the end of May. So the end of this month, that will be, it will stop. Hopefully they'll lift the state of emergency by then. And that one is in Andover, as I mentioned. I'm not gonna disclose the location.
Yeah, so Vilma, so one of the things you were talking about is providing extra resources for these individuals. You did mention, essentially seeing if you might be able to find permanent housing for some of those folks, which I think is incredible. Anytime anyone I say you can do that.
I don't want to say permanent. I should have said stable, more stable housing.
Okay, so what do you? So I'm interested in like knowing like what other resources do you foresee that they might need, and also what you mean about more stable housing.
Stable meaning, some of the guests that came from the local shelters, the agreement was that they will return to those shelters, and then the shelter staff is continuing to provide case management for those folks. Okay. Then you have others that have come to us that's not necessarily the case, who may be eligible, let's say, for Emergency Solutions Grant, and if we have the funding and they're there, then us will work with them to see if we can get them into something more stable. Sandy has worked really hard with the state, with the Department of Housing and Urban Development, Housing and Community Development, to get some of these families home base. So basically, trying to find apartments for all these families, and they get the home base, which is a rental assistance program from the state. And then we're working to see if there's other housing resources through our networks with the state and the region to see if they're eligible for any of those. We understand that it's a huge undertaking, and that we may not be able to help everybody. We have to be honest. This is where our community partners are really key here, because this was put together as a public health response. And so when you have over 100 people, it's going to be very difficult to do that. So let me move from there. I'm about to lose my battery. All right, sorry about that. All right, so we have that one, and right now I believe there's 72 individuals and families. We have about 72, actually no. As of tonight, we'll have 80 individuals and families. We have about 16 to 18 family units altogether. And so it's a handful. We have a lot of work to do. We have to connect them to resources. Some of them show up with nothing, so we have to provide for them their needs. Then we have the second one that's Lawrence-based is the isolation and recovery one. That one has taken a little longer just because hotels don't want us, they don't want people with COVID. And this is for people who do not qualify for the state one. The state one, when you send people to the state ones, it has to be chronically homeless, COVID positive, and with or without substance use issues.
Where is that?
Those are, I think it's in Springfield. There's different places within the state. There are people.
Go into sort of like what we're working on regionally. Did you find, so before the regional shelters were up, where individuals that were infected and met those criteria, were they okay sort of heading to those areas, or did they choose not to go?
They get to choose. I mean, even for us, even for our quarantine site, we can obligate no one to go anywhere, right? But it's offered. Many of them took the option to go there, but it's for homeless individuals. So those who are housing insecure, may or may not make it to those shelters. And that's the population that we're trying to target. Those who, like, for instance, I can give you an example. A couple with a couple renting a room in the city, husband gets, or the boyfriend gets COVID positive, and the woman is pregnant, and they kicked out of the rooming house, of that housing unit. The perfect scenario would have been this, because he's not homeless, right? He doesn't qualify as homeless. He's housing insecure. He would have gone to the isolation site that we're trying to open, and then the wife would have gone to probably the hotel where she can quarantine. That's the kind of population that we're looking for to serve with this, with this isolation and recovery. And we're working with the Lazarus House for this one. And this is for people who have had the virus, but they have mild symptoms, or moderate symptoms. They don't require hospital care. They no longer require acute care, and they don't require like major, nursing facility care, because we don't have the capacity to do that there. Right now, we have hired a temporary registered nurse who's going to manage the site, and we're in the process of hiring some nursing staff and CNAs, because these folks cannot leave the place. So all the services, including the laundry, has to happen within the same house. And so we're working on that. That one is going to be for people. We already have people waiting who have been calling, and the hospital, can't wait for us to open this. This one has a capacity to serve 15 individuals within that home. And then they can stay for 2 weeks. And then hopefully we can get a couple of cohort of people. So we're looking to probably serve around 40 to 45 individuals through this one. This one, definitely you need 24/7 care, 24/7 security, and it's for Lawrence residents. I think that
already in use? Like, are people? No, okay.
It has, so just so you understand, so people understand, this is a partnership with the Lazarus House, and it is a residential program that they have closed. And so we had to have but create a space for medical care, right? So we have to bring more beds. They were just doing the move today. We have to deep clean that space. We have to make sure that we have plenty of personal protective equipment for the nurses, like full on. We have to figure out, purchase new washer and dryer, because we need a larger capacity. I mean, there's a lot of things that need to go in play, but I'm hoping that within the next, mid-May, we'll be able to be up and running. It's just taking a long time.
It's not up and running yet, but once it is, it will be able to accept, you said, 14 to 15 people that sort of meet that criteria. All right, so let's move on to the next one.
The last one is, this is a regional approach. This is the one that the mayor sent his statement about. And basically, for the chronically homeless who may or may not have, be struggling with chronic illnesses or other things, substance use, this one really was put together as quickly as we could. We knew that it was a regional approach. This is the one that we're hoping that, well, no, we're not hoping, but we are going to support it with FEMA and MEMA funds, because it's a regional one, and it's Department of Public Health, it's the state, and the hospital and the clinic who really are working together, who have partnered with us to put this together. This one is in Methuen, and we had to get a vendor, a nursing home care organization to run it. And so right now, I believe they're at capacity, has 60 rooms. Some of them are couples, but I believe they're at capacity as we speak. And that one is gonna run through, I believe, probably beginning of June to mid-June.
So what happens, I haven't had this question yet, but I'm assuming, someone will ask, because every time you put a deadline, someone will say, even myself, or what occurs if, beginning of June, mid-June, nothing has changed and we're still in the sort of like the same area. Do you foresee that, is there a potential to extend it if there's a need?
Right now, our funding is stretched so thin. We only get to run these programs, community development block grant for COVID, and we're using it as an urgent need. And we got $500,000 for emergency solutions grant to help run some of these shelters and support this population. That's it. There's nothing else. The city receives, even though we get a pretty sizable community development block grant every year, you got to remember that it goes into housing developments and funding has been committed to it. It goes to first-time home buyers. It goes to housing rehabilitation programs. It goes to all the park projects that we're right now working on. It goes to supporting those small businesses. So it leaves very little for much of anything. We couldn't even look at our current action plan year to say, okay, we're gonna reprogram some of these funds, because we couldn't. A lot of our monies, all of our funds are committed. And so we're using this funding. Now, I know that there's another round of emergency solutions grant that's coming out, but I'm not certain if it's gonna have the same purpose. This one, the purpose of this funding is to prevent, plan for, and respond to the COVID-19 virus, and really support homeless families and provide the assistance that we need to provide. Next round, I'm not certain yet what that's going to support. And we don't even know how much funding we're going to get, because it's a formula grant. So it's difficult to say that we'll have the capacity, financial capacity to do that.
Well, thank you for sort of, kind of giving us a rundown of where the funding is coming from. What were sort of the lessons as we're closing out? What were the lessons that you've learned from, essentially enacting or, creating these 3 different initiatives?
As difficult as it has been, and you mentioned this at the beginning, it's the partnerships that exist within our city and the resources and the human capital, right? We don't have a lot of money, but we do have a lot of heart, and you have a lot of people who care about the city. And so the cross-sector partnerships and the collaborations is critical. And I learned sometimes to say, we look at our city and we look at what's going on, and we always have, complaint. Now we're late, we don't have this, we don't have that. And I've been on some calls that HUD has put together, the National Community Development Association has put together. And I have to say that Lawrence really is leading the way in so many ways. We were able to quickly leverage on the partnership that already exists. And some of them have been also stemmed from the gas explosions. For instance, Essex County Community Foundation gave us a $20,000 donation just to support this effort and support the families that we're serving. So didn't take a lot of work. We were able to do that quickly. Also, the funding initially, when we got our initial allocation, said, wow, that's a significant amount of money. We'll be able to do, have a great impact, not understanding all that's required to put this monsters together, right? It just requires a lot of funding. We're looking at, and I'm not even counting the Methuen site, which is going to be MEMA funded. And by the way, the city is committed to pay, MEMA and FEMA only pay 75% of the costs. Our city is charged, even though it's a regional effort, our city is charged with paying the 25% match. Wow. And so, yes. So you're talking about $230,000 of my city BG money that I have to allocate to that, the COVID money. So sorry to interrupt. Almost $2 million.
Right. A lot of people don't know what CDBG is. So this money usually, what is it used for? So that way they have an idea of where this $250,000 could have gone if it wasn't for COVID.
For this particular one, it had to be used for COVID.
Okay, so this was COVID.
Funding that we received, it's a supplemental funding. Okay. It was a supplemental funding that was added to our existing annual action plan, our existing allocation, so that we can just devote it to responding to the COVID. And so we had to divvy up the funding. And then there's a couple of shelters that we can also provide support to shelters through the Emergency Solutions Grant to help them, with disinfectant, purchase certain things that they need to make sure that they can continue to run their programs. And so that's what the Community Development Block Grant does. But the staffing capacity, our staff it's stretched out thin. We have had to hire people through the temp agency, and you can only imagine how difficult it is, because nobody wants to be out there. Nobody wants to be exposed to it, even though all of us are exposed. I just went to Market Basket. I could have picked up anything over there, but people are not really very interested in working in the field. By the way, I'm looking for 2 more relief people. If you're interested, 978-620-3526.
Which type of shelter would these 2 relief positions be working?
This is just a quarantine. The quarantine site, yes. So there's no one there with COVID.
Okay.
The complexities of serving this population. So you have people who are pregnant. You have people who probably have DCF, involved. You have probably survivors of domestic violence. You have people who need to apply for all the resources that are available, because how are you going to help them to get stabilized? And so it takes a village, literally takes a village to make this happen. Poverty. I mean, we're a poor community and people don't have the resources. And now you have people who are going to be losing jobs, people who are living on, of unemployment right now. And before this, people were underemployed. There was a lack of quality employment. Our unemployment rates are low, but people don't have a living wages, really decent living wages to be able to survive, right? And then housing barriers. Right now, even though we have 8 of our families who are receiving this home-based rental assistance program, and we're able to support some with emergency solutions grant, the housing cost is too high. And so in order for us to serve these families, it's taking a lot of our time. We have very low vacancy rates, and then there's a high demand for affordable housing. I want to tell you that just the one on Arlington Point, where the Molden Mills, the old Molden Mills, that area, there's 102 units there. More than 800 people apply, and 85% were from Lawrence. Wow. And so the demands right now, people say all these units that are coming online, well, they have to follow the state and the federal regulation, which says you need to run a lottery. And people have already been picked for those units that are still not even built. Wow. And so the demand is too high for us in our city. So that's just some of the lessons learned. But I feel that it's a blessing to be in this city. It's a blessing. I mean, so many people are looking to Lawrence right now for so many different things, and this is one of them. And so hopefully, yeah.
So before we close out, I know that there's a few questions that I saw the folks had asked. This is why I love Lawrence, because every time that there's a crisis, there's an issue, one of the first things that people think about is not even, and I said at the beginning of our discussion, they think about others. So the first question that we got asked is, how do I volunteer? So is there a way that someone who's interested in, volunteering with this can, sign up?
Sure. Do you have Sandy's phone number on your slides?
I did not add it on my slide. I'll make sure that I'll add both her information and your information. I'll post it once we end the discussion. I'll post it on Facebook.
There are so many ways that you can assist. Right now, what we're looking for, is, for instance, we need volunteers to pick up food at one place and bring it to that isolation site every day in the morning. That could be helpful for us. We need people who can help with some of the shifts. Just be there, work with us, help us case manage some of these families. In case management, you don't have to be a social worker. You just have to care for people. There's a guide already there. There's a process for things. That's another way. If you want to call and make a donation for anything, feel free to give us a call. There are different ways that people can support us and volunteer their time, but do call us and we can figure out what's important for you. What would you like to do? And we're open.
That's great to know.
All hands on deck. Come on.
One of the other questions is, so I know that you were talking about waiting until PPE shipment come in. I think one of the questions that a lot of people have been asking, especially after the Board of Health put out their order regarding face masks, is, are the homeless getting face masks? Like what, I mean, there's some individuals even that are not homeless are unable to get educated on, wearing a mask or, coming up with any type of face mask. So they're looking, as to what resources is the city doing to give the homeless, free mask or something, or educate them on that. And you mentioned that it sounds like there might be a shipment or there was a request that was put in or something like that. Is there any sort of information that you give us on that?
So I know that they are hard to come by. I know that they're backed up. I know that, staff gets a box of masks a week. I mean, it's right. It's in ratios, right? But for the homeless, I think that one of the things that they were doing, and I want to say the clinic, Girl Lawrence Family Health Center, is I believe that there were some donations that have been made to the clinic to help distribute some of those among the unsheltered folks. I believe that Lawrence General Hospital got a donation of those cloth ones and that they cannot use. And so they were looking for a place where to donate them. But let me tell you something, people, I mean, we don't have to, if you're a person that just, in the community, get creative. I mean, I have 2 homemade ones that I use and I wash them and I put them back on when I go out, because I actually prefer those over those surgical ones. I find the surgical ones uncomfortable. There are a ton of people making them. I had 2 of my friends, one from church and one former YWCA colleague, who donated a ton of them, cloth ones that I brought to the Andover shelter. And so there's a lot of people out there, and I believe Ralph Galen, I think it was online, he was, and he's working with Jody Amore, I believe. So there, if you look up online, you can find people who are making them. They're charging $5, $3, but if you don't have the money, just be creative. I mean, anything, just cover your mouth and your face.
Well, I think I completely agree with you. And I think, that's one of the things that we've been discussing a lot as we've been educating just like the regular community, right? Or the community at large. I don't want to sort of specify what regular means, right? So the community at large as to what they can do if they can't find a mask, because I think it is difficult finding sort of like the right type, the quote unquote right type of mask. And, not even, we're being asked to not buy those type of masks, that they're more for first responders, people,
Yes.
I think, the question that some folks have is that they see, in other cities that, like Worcester was handing out masks, like they're homeless, and other individuals that they saw. But I think, one of the important things to understand is, like, I have no idea how many masks, some of these cities are giving out. And it's also a matter of trying to find those resources. Like, I got excited when you mentioned that there might be a shipment coming in, and it sounds like it's like you say shipment, but it might be like a small box, right? So, like, you said shipment, and I'm like, oh, like boxes upon boxes, but I was like, great, we can give everyone a mask. But I completely, we've been hearing about it for weeks, that it's hard for institutions to get PPE, so it's going to be hard for a city like ours to come up with that as well. What I would say to people that are interested in sort of that particular issue is, I'm a big believer in, you find a need, you fill the need. So if you see that, organizations, the city, the state, or whatever is not meeting that particular need, potentially that's a way that any individual can volunteer, making masks and then, giving it out to individuals that don't have masks. I am not artistic at all, so I will not be able to do a mask, not even for myself. But I would suggest to anybody that's out there that is able to please do so. I think if the situation was that it was masks were easy to come by, one of the things that I'd be advocating for is for the city or state leadership to take ownership and like buy a lot of masks for us to give out, especially for this population that might not be educated on the topic, but that isn't the case. Lastly, so actually, no. So we talked about all the different questions that I had. At the end of this session, I'm going to post how individuals can communicate with yourself or with Sandy. So I just want to thank you for taking the time to come by to educate others on this topic. For those that are listening, initially what we had thought was that we were going to spend about 30 minutes talking about this, but this is such a complex topic that definitely we went over that. I think Vilma might have told you, we'll take 30 minutes, we'll cap it at 45. So we've gone at the hour point. So thank you for taking your time. Thank everyone that's currently working with you guys. And what I say to the public is, any way that you guys can get involved and help support, please do so. And hopefully we will get this, we'll be done through this crisis, super soon. Okay. Are there any sort of like last words that you'd like to say? Oh, I can't hear you. So Vilma, since I can't hear you, we're just going to close today. Thanks again, and thank everyone that's watching. Have a good night.